Hello, it's Kathleen again, and this is interesting because we're so early in the class and I'm already going to tackle some stuff that's a little controversial. So let's get all the controversy out of the way before we learn, the actual meat of the course. So I'm going to review some things that are kind of on my heart when it comes to doing this work, being a massage therapist that helps people after plastic surgery. So what are kind of the things I'm looking at? The first principle is don't filter down what you know works. And I see this sometimes not so much now that I have clients that come because they're referred. Their doctor has referred to me, but a lot of things that clients will come in possibly expecting comes from the internet, from things that they've read on the internet. And I meet them with things that I've learned through my training, things that I know work because I have done so many massages on so many different clients, and I've seen that this will in fact help you. So what does it look like from the massage therapist point of view? The manual lymphatic drainage that I use was taught to me by close training, and I know that works. It's the type of manual lymphatic drainage that certified lymphedema therapists across the country, across the world are using and helping to get their clients to reduce their swelling after lymphedema, which is often a side effect of cancer treatment. So it's going to work equally as well with people who have edema that's after plastic surgery. So I am always going back to conferences, relearning and learning again, learning more details about the manual lymphatic drainage. So I use the correct pressure, so I use the correct technique, and I don't want to have it fall into more of a light, very relaxing massage. I want to use the type of massage that will actually get clients results. So that's the first thing that I do. If I have received the training and I know that this training works, I'm not going to filter it down to be more like what a client has seen perhaps on the internet. And I tell them exactly why I'm doing the things that I'm doing and why I'm not doing some things that they may see on the internet and think, that are necessary to help with their recovery. So what's the second controversial thing that I want to look at? That is the protocol. So I have been to plenty of conferences, and it's really interesting because there's this thing that foreigners, Europeans will talk about, and that is like if an American walks into a conference, they want a protocol, they want a sheet, they want a checklist, they want to know exactly, soup to nuts, every ingredient, every step listed out. And I do give protocols because I'm an American, so that's how I operate, and I know it makes us feel very comfortable that if we can check off all these boxes, we know that we've done the majority of our work, and we're not forgetting anything for our client. But really the protocol is a mixture of skill set and mindset. So you have to have the skills. You cannot just watch some YouTube videos, watch someone do something once, not actually practice it, not actually go into a classroom environment where you're evaluated by a live person. You cannot get skill set just from watching videos on the internet. I think we know this as massage therapists. It's definitely very good. I definitely look at a lot of YouTube videos, but if you're in this class, you know the importance of getting continuing education, and that has to be hands-on as well as online. So that's how we develop our skill set, by being evaluated by a live person to see if we're actually doing what we think we're doing with our hands and with our body. And the other half is mindset. So I have a curious, open mindset. I'm always willing to learn new things. I don't think I have the top expertise on this or anything else in my life. There's always smarter people out there, more experienced people out there, and I should ideally surround myself with people who are more experienced than me. That's the only way I learn. So my learning is never done. And if I was to give advice to a young therapist, I would say, your learning is never done either. So having that open mindset that not all things work for everybody, that these tools work in one area and perhaps they'd work in another, that will really take you far in developing a style of post-plastic surgery massage that is uniquely yours. So that's my second idea that I would get, that we do have a protocol, but the protocol is also implemented by someone who has both a skill set and a mindset. That's why you can't just take a piece of paper and give it to someone with no training and expect the same results as you would from an expert who continuously gets the continuing education and is in constant communication with a fellowship of fellow massage therapists to always improve their skills and training. So number 3, the communication with the care team is key. And I love this. I don't think this should be controversial at all, but it's interesting how little communication I had with other people in my client's care team as a regular massage therapist. Back when I first started out, I used to work at a chain franchise massage place, and the soap note was just an aside, something you did in 5 seconds. Just have it. No one checked it. No one looked at it. No one was interested in progress. It was just something that, massage therapists sort of have to do this. So here's a tiny little boxes on a sheet of paper. So this is a totally different type of niche. We're helping people who are under the care of a plastic surgeon. They're under the care of a physician, a doctor, somebody that's helping them recover from this surgery. So communication with the care team is key. You should know who their plastic surgeon is. You should feel that you can communicate with their plastic surgeon and share information with them. Again, in the marketing class, I share more about exactly the forms I use to communicate with plastic surgeons. In the app, it's called Doximity, and you can email other physicians, other healthcare professionals on that app, and it's HIPAA compliant, so it's a free app. It's very I highly recommend for you to grab that app too, because that's an easy way to communicate with the doctor. Obviously, the other one is getting the doctor's phone number and leaving a message. But either way that you want to do it, communicating and being a part of their care team is key to helping them holistically recover from their surgery. I like to have curiosity, and I put my patient at the center of care. So my patient is the one who's in charge. My patient is the one that is booking the appointments and paying for the appointments. And I love being cash-based versus insurance-based because it's very obvious to the patient that they are in the center of their care and they're making those decisions. No one is booking, and it's not an insurance company that's either authorizing or not authorizing. It's totally them. They are in charge of their results. And that is also a responsibility as well as a privilege for the client, because you are telling them, a part of your care is all the other things you do in your life, the other 23 hours of the day. It's not just me responsible for taking you in and completely caring for you, and at the end I'm supposed to guarantee that you're recovered. So the patient is responsible. They're in the center of their own care, and I'm always curious about what's worked for them, what hasn't worked for them, what is kind of motivational interviewing style of asking questions, and definitely if you haven't taken any training in motivational interviewing, it's absolutely wonderful. Google it, YouTube it, find out a little bit more and see if you can add this just attitude towards interacting with your patient into your skill set. It's been very valuable to me because it shows the patient that you're interested in them and you want to collaborate with them on their recovery, and that they're in charge of their own recovery, and they don't need a protocol either. They need the customized solution based on what has worked for them and hasn't worked for them in the past. And then this will give them kind of the incentive to take that first step forward and make these actions that will help their recovery. And curiosity, this motivational interviewing is definitely a good resource for us to show the patient that they're in the center of their care. So the fifth one I want to talk about is it's protocol based too. It's that at the end of it, every decision you have is a call, it's a verbal order. It's not something that I can just buy a book on plastic surgery recovery massage and be able to look at the index and have a set answer, because everyone's body doesn't work the same. Everyone is different. Everyone comes and has a different surgery. They have a different surgeon. They have different prior surgeries, prior illnesses, level of health. Like, everyone is unique. So there's no way that we, in the space of a few hours, could cover every single possible question and answer that you would ever get. So everything is down to your level of expertise and the training that is in your experience. And that's why it's kind of easier for me to know the solution, kind of intuit the solution off the top of my head, because of the level of training that I have, because of all the CEU courses, all the seminars, all the conferences, all the travel, all the interacting with other experts, knowing the experts, being able to email experts. Like for my training and for Close training, I've actually been able to get on the phone with Gunter Close and ask him a question about the care of a client, whether I should do the massage or not. And it's that your teachers and that your teachers' teachers will always be there as a resource if you take the lymphedema training. Has been a wonderful way for me to kind of also have the value of their expertise as well as what I have done in training my own self. So that's basically what I'm saying is, like, everything's going to be a call. Everything's going to be, what, based on your training, what you think should happen. There is no, like, static checklist that works with every single client. Everything has not been covered. Everything cannot be answered. It has to be you and using what training you have to make that decision and help the client in the best way that you can on that day. So what is a strategy that I use with clients? I report information to them. I let them know what I'm feeling in the massage. I let them know what I see, and some of the tests we'll get in, some of the ways that I evaluate their swelling, evaluate, if they have fibrosis. I talk to them about that. I let them know what I feel during the massage. I show them if I can, and then I guide their decisions on how their self-care should be in between the massage appointments. So the big one is, when should I get my next appointment? Questions about when should I stop wearing my compression? Like, I hate my compression. What should I do? And kind of just helping them to troubleshoot that stuff. And definitely 100%, if there's a question you can't answer, the beauty of this versus another niche in massage is that I can tell them to talk to their plastic surgeon, to email their plastic surgeon, and they actually do have an expert that is on call that they can email or talk to that will be responsive. So that if there's a question we can't answer, whether you don't know enough about compression, you don't know enough about whatever it is they're doing or their medications, like, those questions are instantly to the plastic surgeon, and you don't have to feel pressure to answer a question that you don't have the expertise in, because there's someone else you can confidently refer to, and that's their plastic surgeon, patient coordinator, whoever is in that business that they got their surgery from. Okay, so now I want to talk about our toolbox and whether things are toys or tools. So I have seen a lot of things advertised, and I have seen in Facebook groups a lot of people who are having plastic surgery, after plastic surgery, asking one another, should I get this to help? Should I get that to help? This roller, that cavitation machine, buying stuff. And it seems as if there's a lot of toys out there that people are kind of playing with versus tools, instruments. And that's what we use. If we have the training behind it, I can turn what would be a toy for someone with no training into a tool that I can actually use to help recovery. So what am I talking about? Just the tools of the trade that we use. This is just a massage cup, and you might not know how to use this effectively unless you get the training. You might not know how the fluid runs in the body, how to properly direct the fluid, how to use this to reduce scar tissue. Again, with a face roller, you can roll this in a certain direction and it might help with lymphatic drainage, and you can just roll it randomly and it'll give you a really nice massage. It'll feel nice, but in that way it's a toy because it's not actually making a difference. And then my other trusty one is the vibrating massager. And this in the hands of someone that knows how to use it, knows how to use the power of vibration and the power of lymphatic drainage to direct the fluid, can have a better result with it than if it's just used as a toy, just like you would give to a 3-year-old. They're going to use it in a different way than someone who has actually had the training and knows, the direction of lymphatic drainage in the body and the proper application of vibration to help after anything that happens with swelling. So that's kind of my idea that I want to share with you. If you don't have the training, it can be a toy. If you do have the training, it becomes a tool and you can use it to help your clients. And then finally, I want to honor the people that came before me. I did not invent any of these techniques. Everything that I learned through close training. I learned through the experience of other certified lymphedema therapists, other massage therapists, different teachers, different continuing education that I took. So I did not invent anything. There are people who have been doing this for longer, for over 20 years. The oldest study that I've seen that specifically talks about using manual lymphatic drainage and deeper techniques to reduce swelling and fibrosis in plastic surgery, specifically mentioning plastic surgery, is from last century. It's over 20 years old. So this field has been around for over 20 years. And I am just one person that came and took the training and developed, kind of put everything together, help my clients with it. There's definitely people with more experience. There's people with a wider variety of experience. What I'm doing in this class is kind of setting the house to order, kind of sharing what I know, segmenting it, showing you my logic and what I've done to kind of understand myself, what I'm doing and how I'm helping clients, and give that to you. All right, so this is the 20 minutes, just under 20 minutes of controversy. So I hope it's not that controversial. This is just, I wanted to get across that this class is not the be-all, end-all. You cannot possibly learn everything about this niche career in massage therapy in just a few hours. But I want to give you the tools you need to kind of understand the way I think. And if you enjoy the way I think and apply that to your own expertise, then you can use these tools that I've collected to help you be a better massage therapist and help people after plastic surgery. Okay, have a good day.